Do you want to live longer, think more clearly, and avoid chronic disease before it ever shows up on a scan? Then there is one blood test that you need to understand, and chances are it's already been misunderstood. I've been an ER doctor for over 30 years, and I'm also a native of one of the world's blue zones. And today, I want to talk to you about a number that quietly predicts how fast you are going to age. It is your hemoglobin, A1C. Let me tell you about a patient I saw last week in my emergency department. She was a 42-year-old, and she looked fit. She exercised regularly, she didn't smoke, and as part of her workup, we ran some routine blood tests. Her A1C came back at 6.2, and she said to me, "My primary doctor told me that I'm not a diabetic," and technically, she was correct. But here's what nobody explained to her in that moment. At that A1C level, glucose had already been binding to the proteins throughout her body, in her brain, her heart, and also the tiny filtration membranes of her kidneys. Not because she had a disease, but because that is exactly what glucose does, even when it's slightly elevated day after day and year after year. She walked out at that appointment thinking that she had nothing to worry about, and what she had actually received was a glimpse of the next 20 years of her life. Most people leave their doctor's office with an A1C result and absolutely have no idea what they have been told. So let me explain what this number is actually revealing about what is happening inside your bloodstream right now. Here's what almost everyone gets wrong about an A1C. They think it is a diabetes test, that you're either diabetic or you're not. And if you're not, then you are fine. That kind of binary thinking creates one of the most dangerous blind spots in modern medicine. Because your A1C isn't measuring whether or not you have diabetes today, what it is actually measuring is how much biochemical damage has been quietly accumulating over the last several months. In fact, 3 months. Inside of your red blood cells is a protein called hemoglobin, and its job is to carry oxygen. When glucose circulates through your bloodstream, some of it will spontaneously just stick or bind to that hemoglobin. There's no enzymes needed, and there is also no control mechanism. It just happens. And the higher your average blood glucose, the more sugar attaches itself. Once it's attached, it stays there for the entire lifespan of that red blood cell, about 8 to 12 weeks. So when you look at your A1C, you are not seeing yesterday's spike that you had after breakfast. What you are seeing is a weighted average of your glucose exposure over the last 2 to 3 months. Every meal, every late night snack, every stress-induced glucose surge. That is the total biochemical environment that your tissues have been soaking in. And this is why that distinction matters. Damage at the cellular level isn't about one spike. It is about cumulative exposure. You can have a perfectly normal fasting blood glucose and still be glycating proteins throughout your body if your post-meal glucose stays high for hours every single day. Millions of people are told they're not diabetic and they walk away relieved. But that label often masks years of silent damage that are already well underway. Your cells don't care about a diagnostic cutoff. Your blood vessels don't care. Your brain doesn't care. They only care about the chemical environment that they are living in day after day. Once you understand that A1C reflects your long-term glucose exposure, the next question becomes very obvious. Why is that glucose attachment so damaging? Glucose doesn't just stick to your hemoglobin, it also sticks to your proteins everywhere throughout your body, in your blood vessels, your skin, your kidneys, your eyes, your nerves, and that sticking process is called glycation. Once a protein becomes glycated, it changes its shape, it loses its flexibility, and it loses its function. Your blood vessels stiffen, your enzymes malfunction, and your structural proteins weaken. Glycated proteins also trigger other things like oxidative stress. They generate reactive molecules that will damage your DNA as well as your cell membranes and your mitochondria, your cell's powerhouses. Your immune system recognizes these proteins as being abnormal, and they attack them and mount a chronic inflammatory response. Meanwhile, your stiffened blood vessels are delivering oxygen less efficiently. The result is that your brain, your heart, your muscles are now operating in a mildly low oxygen or oxygen-deprived state. This is how glycation accelerates aging at the microscopic level. It's not just about the wrinkles, although your skin collagen glycation absolutely drives skin wrinkles. It's about every single organ system throughout your body gradually losing their ability to function, their vital capacity. Our arteries are stiffening and it's causing our blood pressure to rise. Our heart has to then work harder. Our brain insulin signaling is weakened. It causes brain fog. Our kidney filtration membranes are becoming stiff and slowing down our ability to clear waste from our body. Our nerves begin to lose conductivity. The result is pain, numbness, as well as dysfunction. We call it neuropathy. And here's the cruel twist of fate. People assume that sugar damage only matters once you cross into diabetes, but our biochemistry doesn't work that way. Glycation is happening right now throughout our body in proportion to our average glucose exposure. And the difference between aging slowly and aging rapidly often comes down to how much glycation has accumulated silently over the past years. If this is shifting how you think about your A1C, hit that like button and please subscribe. This brings us to what A1C numbers actually mean. Medical guidelines say that below 5.7 is normal. 5.7 to 6.4 is pre-diabetic, and 6.5 and above is diabetic. Clinically useful, of course, but it doesn't tell the whole story. Someone with an A1C of 5.3 and someone with an A1C of 5.8 are both told that they're normal, but their long-term health trajectories are very, very different. Research shows that every incremental rise in A1C, even within that normal range, will correspond to a higher risk of heart attack, stroke, as well as dementia. And that risk doesn't suddenly appear at diagnosis. It follows a smooth, continuous upward curve. For longevity and performance, your optimal A1C should be about 5.2 to 5.3%. That is where glycation is at its minimal. Your insulin sensitivity is still high, and your metabolic flexibility is well preserved. Normal is not the same as optimal. Many people say that they feel fine at those higher A1C levels, and what has actually happened is that they have now recalibrated their bodies to be able to function at a suboptimal level. Their fatigue, the brain fog, the mood instability, and that constant hunger and craving aren't just normal parts of aging. They are actually early metabolic signals. This is one of the huge health literacy gaps that we have. People are told they're fine when in reality they are on a trajectory towards chronic disease. This then raises the real question: why does your A1C drift upward so easily in modern life? It's because the Western modern diet and lifestyle is hostile to glucose regulation. Sedentary work results in loss of muscle, reducing our ability to dispose of glucose. Poor sleep raises our cortisol and our adrenaline. Chronic stress will keep our glucose circulating much longer than it should. A diet of ultra-processed carbs, liquid sugar, that bread, pasta, cereal, potatoes, pastries, all break down rapidly into glucose. And liquid sugar is even worse, because what it does is it actually will bypass our mechanisms for satiety. Late night eating hits when insulin sensitivity is the lowest. Alcohol will also destabilize your glucose as well as your sleep. We've all normalized all of these disruptions to our glucose metabolism, and the result is chronically elevated glucose exposures. When the A1C rises, the damage doesn't stay confined to your metabolism. It affects your whole body, your brain, your heart, your kidneys, your nerves, and also your immune system. That is why A1C is one of the strongest predictors of whether or not you will develop those chronic diseases. The good news is A1C can absolutely be lowered. It will respond to lifestyle changes, improving our sleep and maintaining our muscles. Eating food that doesn't spike our glucose will all lower our hemoglobin A1C. And when the A1C improves, we are not just changing a number, we are actually slowing our biological aging. When we focus on small, consistent shifts, they are going to compound over time. Your A1C isn't judging you. It just simply records the story of your daily habits. And that is a story you write every single day. Feedback only matters, though, if we are going to act on it. Thank you for joining me today and for subscribing to my channel, because this is how we can slow aging from the inside out. We'll see you for the next episode in this series on the Dr. Joanette channel.